This is a great question. What's one Medicare decision that too many people regret later? Universally, the one decision that they make is not to decide, is that they forgot that they turned 65, or they've been living in Mexico, or they were distracted, or they were doing something else, or. To not enroll in Medicare during the initial enrollment period creates obstacles that are very difficult to unwind later on. So, for example, if you forget that you're 65 and your birthday's in May, and then the following May comes around, you're going, oh my God, I'm 66. I didn't enroll in Medicare and I haven't had any insurance. You're going to have a permanent late enrollment penalty for quite a bit of money, because guess what? It's May and you can't enroll in Medicare until January, February, March, usually for a July 1st enrollment, unless, of course, you had an employer-sponsored plan. Then you've got a gimme. But for people that are just spaced, they will face hundreds and hundreds of dollars of costs associated with just not knowing what their birthday is and what their requirements are. So most of my clients hit me up because they're really scared of that. That's my answer to that question. The second item that individuals regret is just picking any old plan. For example, I'm going to Kaiser, for example, or HealthNet. My mom had HealthNet. She liked it, without going through the discipline of seeing if actually there's any providers in your community under that carrier. And I just use those for no other reason other than those are two that have come up in my community as not having solid and extensive specialists, for example. So I think those are the two, is just not being careful about enrolling in a Medicare Advantage policy, not doing the research on your area, and for crying out loud, just enroll on your 65th birthday. Just get her done,